We are gonna see Parkinson's disease. So, what is Parkinson's disease? Parkinson's is a chronic and progressive movement disorder. Although there is no known cure, early diagnosis and appropriate treatment can significantly delay the disease progression. Now, we see causes and symptoms. Before that, I have taken a diagram which shows how the normal neurons of a normal person react and how the Parkinson's affected neurons react and send the signal. Where we can see there are more number of dopamine in normal person's case. In a person affected with Parkinson's disease, they have less number of dopamine. So moving on to the causes and symptoms. Causes. The causes of Parkinson's are still unknown. However, researchers believe that a combination of genetic and environmental factors might trigger the disease. Exposure to certain toxins, head injuries, and consistent usage of certain medicines might increase the risk of Parkinson's. Symptoms. Parkinson's early symptoms may be very mild, making it hard to diagnose. The most common symptoms include tremors, stiffness, slow movement, and impaired balance. Other symptoms are sleep disturbance, loss of smell, anxiety, and depression. Statistics. More than 10 million people worldwide are living with Parkinson's, and the number is still increasing. It is the second most common age-related neurodegenerative disorder after Alzheimer's disease. Then the moving on, I have taken one more picture which shows Parkinson's disease symptoms. The possible early non-motor symptoms are loss of sense of smell, drooling, constipation and gastrointestinal problems. Then sleep problems such as restless leg syndrome, mask-like facial expression. Then we have common motor-related symptoms as slowed movements, tremor while muscles are at rest, rigidity or stiffness, blinking less often than usual, trouble swallowing, unstable posture or walking gait. Then we have types of treatments. Physical therapy. Physical therapy can help individuals to maintain their balance, mobility, and muscle strength. Regular exercise may also help to reduce symptoms and slow the progression of Parkinson's. And we have deep brain stimulation. DBS is an implantable device that sends electrical signals to certain areas of the brain to control the abnormal movement caused by Parkinson's. It can improve symptoms like tremors, stiffness, and slow movement. Then we have the medications. Medications such as dopamine agonists, MAOB inhibitors, and levodopa can alleviate Parkinson's symptoms. Levodopa is the most effective treatment for Parkinson's, and most people with Parkinson's eventually require this medication. Then we have occupational therapy. Occupational therapy helps individuals to maintain their independence and perform daily activities despite their symptoms. It can provide strategies to help cope with tremors, stiffness, and the difficulty with fine motor tasks. Now we have medications for Parkinson's disease. First one, dopamine agonists. These medications stimulate the production of dopamine, a neurotransmitter that is deficient in Parkinson's disease. They are used to elevate tremors, stiffness, and slow movement. And we have MAOB inhibitors. These medications increase dopamine levels by blocking an enzyme that breaks down naturally occurring dopamine in the brain. They are often used as precursor to levodopa or in the early stages of the disease. Then we have levodopa. Levodopa is the most effective medication for elevating Parkinson's symptoms. It works by increasing dopamine levels in the brain. Unfortunately, it tends to lose its effectiveness over time and can have side effects such as dyskinesis. Then we have anticholinergics. Anticholinergics are used to reduce tremors and muscle stiffness that are characteristic of Parkinson's disease. They are not commonly used today because of their potential side effects and safety concerns. The surgical procedures used are pallidotomy, a procedure that involves making a small incision in the skull and inserting an electrode to destroy a small part of a brain region called the globus pallidus. This procedure is used to elevate abnormal movement. Then we have thalamotomy, a procedure similar to pallidotomy, but the physician destroys a small portion of the thalamus instead of the globus pallidus. This procedure is effective in treating symptoms like tremors. Then we have deep brain stimulation, a procedure that involves the implantation of a device known as a brain pacemaker into the brain. An electrode is inserted into the brain and electrical impulses are used to stimulate the targeted area of the brain. Deep brain stimulation can significantly improve the symptoms of Parkinson's. Then we have lifestyle changes and therapies that we need to do. Yoga and meditation. Yoga and meditation have been shown to elevate stress, reduce anxiety, and improve flexibility and balance in individuals with Parkinson's disease. Then, healthy eating. Healthy eating habits can provide the nutrients needed to manage the symptoms of Parkinson's disease. A diet high in fiber, vegetables, fruits, and lean protein is recommended for people with Parkinson's. Then, socialization. Social isolation can increase feelings of depression in people with Parkinson's disease. Participating in support groups and engaging in social activities can help elevate these feelings. The, the future research and developments on this gene therapy. Researchers are exploring the use of gene therapy to treat Parkinson's disease. In this therapy, healthy genes are inserted into the brain cells that produce dopamine to reduce symptoms and slow disease progression. Then we have stem cell research. Stem cell therapy is a potential future treatment for Parkinson's disease. It involves replacing the damaged cells in the brain with healthy cells generated from stem cells. And we have artificial intelligence. Artificial intelligence technology can improve the diagnosis and treatment of Parkinson's disease. It can predict disease progression and help doctors create personalized treatment plans for individuals with Parkinson's. Thank you. Hope you like my presentation.